Hi, everyone. My name is Michelle LeRae. I am the founder of the Spirit Guided Path and Death Doulas of Manitoba. And today I'm going to be talking a little bit about how to best support your loved one as they are entering the active dying phase. And so, when someone we love has been ill for a little bit, whether it's been weeks, months, even years, there comes a point at which they start to do what we would refer to as a decline, where they become less mobile, they're less interested in eating or drinking, and they may be generally less responsive to social interactions. So they might not seem like they want to communicate that much with other people or to have a lot of visitors. This is all very normal and natural as they progress in their illness. And so, for those that are supporting somebody, this can be really challenging because up until this point, it may have felt like all hands on deck. Everyone is being productive, making sure that they get to their doctor's appointments and focusing on treatment plans, as well as, even looking for different medication trials and everything else. And so, all of that starts to fade away. And as it is possibly accepted at this point that the loved one is going to die, and they may be entering into hospice care with a signed DNR, do not resuscitate, and being willing to allow natural death should any medical emergencies arise. This can feel almost counterintuitive when we feel like we should be doing something. And it, feels like we're not being proactive anymore. We're not being productive. We're trying to, get accustomed to the fact that we no longer need to be doing as much as we were, but the strain on our energy may even be greater because it becomes more all-encompassing, the care, the primary caregiving being there almost 24 hours a day and constantly trying to make sure that their level of comfort is at the best it could possibly be. And so being present with what is really the most important. Some days your loved one might eat as much as two meals, and they may be able to sit up and have a discussion and talk about what's going on in the moment. Other days, they may sleep 80% of the day and barely be interested in drinking any water, or they may not even seem like they're in the present moment talking about the past a little bit. And these are all indications and signs that are very normal as they kind of go on the ups and downs towards active dying. Unfortunately, it can be very confusing and you might feel very unsure some of the time because some days it might feel like they are headed towards that time where they may actually be transitioning, where they might be dying. Whereas, there's often really, steep ups and downs that can be confusing, and that's normal if you're not sure. And so this is where you definitely want to keep in communication with their care team. And if you have access to the support of your local death doula, this can also be very helpful to tell them what is going on and to have their, support and guidance as you're approaching that time. And so it's really important and can be very helpful if you begin to trust your loved one to almost lead the way with this. They know what they feel on the inside. If they feel inclined to say no thank you to food and water, you're not really allowing them to starve. Their body simply doesn't need it anymore. And trying to force this or encourage it, because again, it's one of those things when we care for people that are sick, we want them to start eating and drinking because it's usually a sign that they're starting to gain strength and to get well. But this time, this isn't going to happen. And by forcing it, thinking that somehow this is going to make them feel better, it actually can be more painful and make them feel worse because their body is no longer digesting it in the way that it used to. And it can just sit there and be very uncomfortable. And depending on what they're actually experiencing in terms of their diagnosis, sometimes it can actually be much more harmful than we imagine. So, not denying food ever. If they want it, please give it and, follow their lead with it. But if they finally say, no, I don't think so, or they're pushing away from it if they can't be verbal at that time, it's okay. You're not starving them, you're not dehydrating them. Their body is simply going through a natural process. And this can be really difficult in our very productive, valued world where we want to do something to help. But when it comes to being with dying, less is definitely more. And as challenging as this can be, having this encouragement might help you to remember that when this time comes, it's okay to simply be present and not try to keep doing something that might actually be making it worse for them. And so, as they enter the active dying phase, which is a time that we often refer to as vigil, this is a time to sit with them, to quiet the room. I always call it setting the tone. This is different than the weeks and months leading up to this point, where you may have had the TV being a bit louder so they could hear it with their favorite shows, or you might have had lots of lights in the room so they could see or even read. But this is a time where they are going within themselves to prepare their bodies for the labor of dying, which is something that is very sacred, and it requires concentration. And so this is where it is encouraged to set the tone in the room where this is, possible for them to not be, too interrupted. So if possible, no unnatural lights. If you have to have a lamp on, a dimly lit lamp, possibly, behind them if possible, so that there's nothing shining in their eyes. There's nothing more jolting than someone coming in and turning on the lights and all of a sudden kind of jolting them out of the process. Even if they don't become awake, it definitely has an effect that can be uncomfortable or unproductive with what they're going through. Trying to reduce the amount of movement. Often, we still feel like, okay, we need to move them so that we can avoid any ulcers and all of that. And yes, definitely moving them to, the most minimal degree to make sure that there's a decrease in any discomfort, but probably not to the same level at which when they were still awake and, eating and conscious, trying to minimize the amount of anything that might disturb their process. So this means no loud noises. You don't need to come into the room and announce yourself loudly. This is a time of peace and quiet where if you want to communicate with them, I find speaking softly in their ear can make a big difference. Just very gently saying, I'm here for you. I'll be here for the next 3 hours. If you need anything, I'm here. You know, holding their hand very gently. You might say, well, they've maybe lost the ability to hear, but at this point, it's much less about what they physically hear and much more about the energy in the room. And this is where, I truly focus on the fact that I feel that death is very sacred, and this is something that kind of takes place on a more energetic level versus anything else. And anyone that sit with anyone who's had the opportunity to sit with anyone who's dying, you might be sensitive to the energy shifts in the room. So this is very powerful, actually, and a great indicator of just how magnificent this transition can be. And so keeping calm and peaceful, trying to obviously minimize the disruption, not having a stream of people in and out of the room, just trying to keep it as minimal as possible. And obviously keeping up with whatever the treatment plan is for their pain, their comfort level. Obviously keeping in touch with the palliative care team or doctors and nurses that are helping with this aspect. And if you're working with a doula, of course, doulas are not medical roles. So you might have a doula on board to help with the emotional, mental, and possibly spiritual side of things. But obviously, you have your palliative care team to help with the medications that will be keeping your loved one comfortable. And so, if they are in the active dying phase, this is a time to speak softly in their ear. You can talk about the gratitude you have for the role they have had in your life, what they've taught you, what they've motivated you with, how they've inspired you, what they've done, even reminiscing about wonderful memories, whatever it is you want to say to them. You can't say too much about those moments of being connected, and even encouraging them that when they feel ready, that it's okay to let go. Not um, we're not trying to encourage them quickly to leave, but reminding them that it's okay for when they're ready to do so. Some people do hold on and they feel like they're letting their loved ones down, especially if even up until this point, someone is saying, to keep fighting, to keep trying to stay here. It's not a failure. Death is not a failure. Death is not, dying is not a battle. We're all going to eventually go through this. And so it can be really helpful, especially in those moments, but hopefully far before those moments have arrived, to remind your loved one that, you're proud of them, you love them, you're grateful for them, and that it's also okay to let go. And it's okay to go home, or however you want to word it, to die, to go to heaven, whatever feels comfortable for you and your personal beliefs. You can hold their hand, you can sing softly, you can have their favorite music playing, but quietly. Again, much quieter than you might think they actually need to hear. They don't need to hear on the physical level anymore. This is more of an energetic level when we are in the active dying phase. So less is more, keeping it as peaceful as possible. Um, and just being very present. You can even, if you're so inclined, if there are loved ones that maybe they had been mentioning that had died and they were starting to talk about them, which is very normal and natural, of course, as they're preparing to die. You might tell them, well, they're waiting for you. Whenever you're ready, they will greet you with open arms, and it is okay. So, trying to find the most meaningful way for you to connect with them as they approach this phase. And if you find it too difficult and you don't have any words and you don't know what to say, even just being present, you don't have to do anything. Just being present to lend your support, to be there as they are preparing to let go from this world. That is enough. Whatever you're doing is enough. You don't need to do more. Just being there and being there for them and encouraging them and supporting them, even quietly, energetically, if you have no words for them, that is perfectly fine. And so I hope that this has been helpful for you. A lot of people don't know what to do when this time comes, and uh, it's something that we're just not brought up with. We're generally not taught how to sit with the dying, but you can do this. However, just listening to your own intuition, however you feel is best for your loved one. You know them, you know what they would respond to. They might like physical touch. By that point, they may not. You might just want to make sure that they're as comfortable as possible, and just being present with whatever you think will help them. You might want to read to them if there's a favorite book, if there's a passage or something, a poem, you can read to them, you can talk with them, you can encourage them, whatever feels right to you in the moment. And I find this is always a great time to be very grateful for them and to remind them how grateful you are that they spent, part of their life with you, however that looks. So as always, if you have any questions about being with those who are dying, or anything about preparing, advanced care plans, legacy projects, how to become a doula, how to work as a doula, don't hesitate to reach out to any of the websites that I have so that I can answer your questions and offer some insight and guidance that might be helpful to you. Until next time, thank you very much.